Hi, I'm here to tell you about a new medical website designed especially for older folks. Website, you say? I can't work on computers, they're not senior friendly, blah, blah, blah. But the National Institutes of Health fixed all that. Now you can make the type bigger, increase contrast, even make it talk to you.
Arthritis.
Just go to NIHseniorhealth.gov and get the best medical information available anywhere. NIHseniorhealth.gov, built with you in mind.
Welcome back to Healthcare from the Hill. We have with us Juliet Bracchio, competitive cheerleader, who will now show us what she can do. If we just first concentrate on the hip, for instance, this is what's considered neutral as you stand. Extension will be moving to the back. Flexion would be moving to the front. Rotation, there's external rotation, where it's rotated out, versus internal rotation, where the hip is rotated in. As well as abduction, where the hip moves out, and adduction, when the hip moves in. So let's see how far we can go. If we first watch me, as I'm standing next to Juliet, this is as far as I can go with extension. Flexion, just about this much. Rotation, I can do some rotation. And abduction to the side, adduction to the other way. Let's see if she can show us off and show more than what I can do. Go ahead, Juliet. So as you can see, that's a lot better than what I can do. This is 180 degrees. Normal range of motion would be about 10 degrees of extension of the hip and about 110 degrees of flexion. And if you do that again, Juliet, she's going to be able to reach almost 180 degrees, if not 180 degrees, of mobility of her hip. That requires the joint to move well, the ligaments to be lax enough, and also the muscles to be able to do it. Go ahead. That's flexibility. That's professional. That's time of stretching. Can you do a split for us also? So here we see 180 degrees as she's on the stage. Again, normal is about 10 degrees of extension to the back. And if I try to do it next to her, that's not even close. So she obviously has a much more flexibility than I do, and her joints are more mobile. How about something else you can show us? So she can actually rotate both ways as well. So her extension, flexion, even rotation is fairly significant. How about something for the shoulders? Just like before. So if you look at her shoulder, can you do it on this side here? One more time. And she stops right there. You can see how forward she shifts the ball in her shoulder just in order to bring it all the way back. Where normally you would be stopping somewhere down here. For her, she's able to go fully 90 degrees backwards. Again, show us how you do that. And now, if you just show the shoulder itself, one more time, you can see right here how the ball actually moves forward. What else can you show us? Legs, knees. So once again, foot above the head, 180 degrees. That's full abduction of the hip. You can see the foot position next to the head, how much internal rotation she has of her leg in order to enable to get that motion for her. And on top of that, when we spoke about proprioception and knowing where your joint can be, she actually is able to balance on her left foot while she's doing everything on the right. So she's able to compensate and shift her body weight to the left side in order to get that stability. How far can you flex your knee, meaning bending your knee backwards like this? So you can see here, she's almost able to do it to the extent of where her muscles can reach. Her legs are essentially touching one another. And normal mobility of the knee is about 140 degrees. She has more than 140 degrees. 0 would start here, 90 would be here. 180 would be in line with this. So you can see how far she's able to reach that. Are you able to have hyperextension, which means stretching the other way like that? So if you look at her knee here, you could see how she actually stretches forward or have hyperextension of the knee. But we rotate a little bit this way so we can show to the camera. Fully straight would be somewhere here, but she's able to actually get hypermobility and extend the knee more than what is normal. Usually at 0, that's full extension, but going more than that is a lot more flexibility. The problem is when you have this much flexibility, you do put a lot of stress on your ligaments, and you can actually injure it more. Your ACL, your PCL, what consider the cruciate ligaments within your knee. Now they have to compensate a lot more and stretch. So if you do something abnormal or jump or land in a different position, you're really depending on your muscles now or your dynamic stabilizers to protect your knee, because your ligaments in your joints allows more mobility, so there could be an injury that can occur. Your muscles here, extremely important. And as you can see her muscles everywhere. She's in good shape, she maintains flexibility, and she has great muscle tone. Juliet, you've been actually very good, very impressive, and we hope to actually see you continue to compete, stay healthy, do the right thing, and obviously make your team proud.
Thank you.
I appreciate your time with us here. And what we have coming up, we're going to speak to Christina Howell, who will speak to us about education as well as social work and how it affects students in schools as well as each one of us in different aspects of medicine. We'll be right back. Welcome back to Healthcare from the Hill. We have with us here Ms. Christina Howell, family advocate of Stanford Academy, who will speak to us about some of the education and social work that can affect most of us and the students at schools today. Christina, thank you very much for being with us.
Thank you for having me.
It's an honor to have you here.
Thank you.
Why don't you tell us a little bit about yourself and what you do?
So I am a family advocate at Stanford Academy in Stamford, Connecticut. It's a charter high school run by DOMIS, which is an organization started in 1972 in Stamford. So there's 3 facets to it. So we have educational, residential, and community. So we have the high school. We have another middle school, which is located not far from the high school. We also have an outreach community center called Chester Addison Community Center in Stamford. And we have 2 residential homes for boys in Stamford called Domus House and Passages.
Do you also work with individuals beyond those areas?
No, I do not. So at Stanford Academy, I have a caseload of about 20 students, and I work with them and their families to help them overcome any type of barriers that are getting in their way, either in the classroom and outside of the classroom in the community. Whatever I can do to help break down those barriers so that they can be successful.
And just for example, what type of barriers would you be dealing with?
Sure. So a lot of families and students as individuals have to deal with certain types of traumas in life. So deaths in the family, definitely poverty, not having enough money to put food on the table, being at least 4 grade levels behind in reading or in math. So we work with them as a support system to put in place whatever type of support they need to help them be successful and pursue excellence in their life.
So essentially from the financial aspect to the academic aspect
Yes.
to the social aspect to the family environment.
Absolutely.
Overall.
Yep. So our goal for the family advocate model for DOMIS, overall, we have family advocates in a few different high schools in Stamford. We just opened a new school in New Haven called DOMIS Academy. And we also have the middle school. So we have family advocates in place everywhere. So our goal is to address the barriers that are related to learning. So like we mentioned, financial, family, any type of situational thing that will get in the way of them succeeding. And our approach is really relationship-based. So we believe that in creating relationships with students and their families, we're better able to help them overcome whatever type of barrier is in their way. So can I talk a little bit about some of the activities?
Absolutely.
All right. So as a family advocate, some people think of us as guidance counselors, and I always say, sure, you could think of it that way, but we're a lot more than that. We run the spectrum of home visits. So we are in the family's homes, whether it's a daily thing, going to pick up the student to come to school because maybe transportation is an issue, or monthly home visits, just checking in on the family to make sure that they have what they need in the home so that they can get up, get dressed for school, and come. And home visits definitely help with building relationships and knowing that, we're on the same level. I might be there to help you, but we work as a team. Another important aspect that I work with families is connecting them to community resources. So whether that has to do with housing, healthcare, mental health, I'm able to reach out and get them whatever type of resource they may need. We facilitate in-school counseling meetings. We're there to sit in on PPT meetings with the student and their parents. We also attend out-of-school meetings with students, which is a big thing. So we go to court with them if they're court involved, college interviews. We also meet daily with teachers to make sure that the students are on track and, to put together any type of plan that may help them be more successful in the classroom.
How are you able
Definitely.
to coordinate all this